everyone. شكرا للكل انضمامكم معنا اليوم. حابة أعرف بنفسي شوي. أنا اسمي بيان الشحروري. أنا graduate student و research assistant في Temple University حاليا في Pennsylvania, America. I am a Fulbright scholar for the next 2 years. In addition, أنا senior regulatory affairs officer في شركة الحكمة للأدوية. اليوم راح أحكي عن موضوع like it's very novel about a state of our technology, nanotechnology actually, and what are the solutions this technology can offer for us to fight against COVID-19. So today I'm going to talk about nanotechnology and in the fight against COVID-19, the recent research advances in the United States. During the talk, we will familiarize ourselves with COVID-19. What is COVID-19? What's the symptoms? What's the virus itself that's causing this disease? To appreciate how dangerous is this disease, we are going to see how this disease evolved over time. In addition, we are going to talk about reasons why this disease is very serious, and we are going to discuss the nano-based solutions offered and under investigation now against COVID-19 global challenge. So let's start with COVID-19. Why they are calling it COVID-19? It's an abbreviation for coronavirus infectious disease that was discovered in 2019 in December. This virus is a new member in a huge family called coronaviruses. And if you can remember, it caused SARS and MERS in 2002 and 2003. According to literatures and investigation, this virus jumped from an animal to human being, and it was discovered in a group of people, 4 to 5 people, that were having dinner in some restaurant in China. This is just hypothesis. They are not sure till the moment where the disease started from. The reason of this, or the cause of this disease is a virus called SARS-CoV-2, which is an abbreviation for severe acute respiratory syndrome coronavirus 2. The symptoms for this disease, the most common one is fever, cough, and fatigue. There are less common symptoms, which is like sore throat, headache, vomiting, abdominal pain. However, all of those symptoms could evolve into septic shock or even organ failure like kidney and heart and lungs. That's why it will lead to death eventually. The incubation period of this virus is almost like 5 to 14 days before even the symptoms appear, which make the disease very dangerous for us. Simply to familiarize ourselves about the target of this disease, the key target of this disease in lungs is a very abundant receptor called angiotensin converting enzyme receptor. The virus will attach itself to this receptor, internalize, and eventually release the genome in the cell to replicate and invade other cells. I've made this in order to appreciate how serious is this disease. This timeline is during only 7 months. Let's start with the first person or the first case of COVID-19 that was identified in November 2019. I don't know, he or she was like 55 years old. Patient, one of the group of people that were having dinner in a restaurant in Wuhan, China. By December 2019, this disease was spreading only from a human to another human in a close contact. By the beginning of January, they could identify that this virus is an RNA virus, and they could identify the sequence of this virus. By the end of January, WHO announced that this crisis is a public health emergency of international concern. By the beginning of February, they discovered a similarity between SARS-CoV-1, which caused the SARS before in 2002, and the new virus, so that's why they are calling it SARS-CoV-2. By March 2020, WHO declared COVID-19 outbreak as a pandemic, and by June 2020, the last month, this virus is spread in more than 188 countries with more than 10 million cases and 500,000 deaths, it's now almost 11 million. So during only 7 months, this virus moved from one case to 10 million, more than 10 million cases worldwide, and moved from a small city in China into 188 countries all over the world. So it's very serious disease and it's spreading very fast. But why we do need urgent solution? Why COVID-19 is a global challenge? First of all, COVID-19 spreads rapidly and easily between people in close contact. And for people who are saying that COVID-19 is the same as a flu virus, no, according to researchers, the COVID-19 it's 10 times more deadly than flu virus. So we cannot say it's the same. Also, COVID-19 is contagious even before the symptoms start. So a person can don't know if he has the disease or not, but he can infect other people. In addition, this virus is an airborne virus, so it will stay in the air. So how we could control something we cannot see? Also, we do not have vaccines. We do not have a treatment till the moment. All of those options are under development right now, and we do not have. No one is immune against this virus because it's very novel virus. All of those reasons urge the scientific community to collaborate to come up with solutions to overcome this crisis or global challenge. But in all of this, how nanotechnology can help us? I want to give you like a simple definition of nanotechnology. Nanotechnology simply it's the manipulation of the size of the material. You are formulating the material in a nano size, like from 1 to 100 nanometer. Nanotechnology has proved its success in different fields, in engineering and in pharmacy. Let me talk about my field, which is nanopharmaceuticals. We are using now nanoparticles to treat cancer, and there is already produced drugs in the market to treat cancer. So, how nanotechnology can support this situation? What are the offered solutions by nanotechnology? We are going to discuss the solutions that's offered by nanotechnology in the field of the treatment and the vaccination, in diagnosis, in disinfection, and in the production of medical supplies like masks. And we are going to discuss the most recent advanced research going here in the United States in those four fields. So let's start with the vaccination. If you remember, in January 2020, they could identify the sequence of the virus. By March 2020, the first candidate vaccine entered phase 1 clinical trial. After that, and up to June 2020, there is 10 candidate vaccines in clinical trials and more than 114 candidate vaccines in preclinical development. How nanotechnology can assist in this field? First of all, there's two approaches. Either we formulate the nanoparticles to amplify the host immune response, and we can use specific materials like nanodiamonds or graphene, or we can use the nanomaterials as nanocarriers. It will carry our vaccine into specific site, which we call it targeted delivery of vaccines. As an example, as a real example that's happening now in the United States from Moderna company. It's a company, it's located in Boston. This company has entered the phase 1 clinical trial for a nano-based vaccine, which is messenger RNA vaccine encapsulated in lipid-based nanoparticles. Another company called Novavax, which is located in Maryland. This company also developed a nano-based vaccine, and it's in phase 1 clinical trial. It's a full-length SARS-CoV-2 glycoprotein nanoparticle vaccine. Other companies are working on this, huge companies like Pfizer, GSK, AstraZeneca, and BioNTech. So we can expect that the next vaccine that will prevent COVID-19 from spreading, it could be nano-based vaccine. In the field of a treatment, nanoparticle or nanotechnology can offer us solutions in two different approaches. First of all, either we synthesize nanoparticles itself to inactivate the virus. It will bind itself to the virus and inactivate it. Or we can use again the concept of nanocarrier to load the drug or the antiviral in it and deliver it to specific site where to the cell that have the virus. An example of this is a very novel approach which called photodynamic inactivation of the virus. Example of this is the sodium fluoride nanoparticles. It has on its surface a photosensitive agents. Those photosensitive agents, when excited, they could generate reactive oxygen species that they suggest it will lead to cell death. Another very well-known example is remdesivir. Remdesivir is a drug produced by Gilead company. This drug or antiviral, it's already found in the market, but now they are testing or investigating its activity against COVID-19. So this drug in phase 3 clinical trials, we can expect soon promising results of it. And one of the formulas of this drug is a nano-based formula. They loaded this drug in nanoparticles to deliver it to cells that has the virus itself. In addition to the field of vaccination and the treatment, nanotechnology can help us in the diagnosis or to detect the presence of SARS-CoV-2. A good example on this is called gold nanoparticles. As you can see, gold nanoparticles, we could attach antibody to the surface of those gold nanoparticles. When the virus is there, a complex will form between those antibodies and the antigen of the virus. This interaction will lead to accumulation of the gold nanoparticles and will shift the color from red to blue. So it's a very simple way to detect the presence of SARS-CoV-2 in our body. And actually, there is a lot of research groups in the United States are doing researches to produce quantities of this diagnostic test. In addition to the field of diagnosis, treatment, and vaccination, we have the contribution of nanotechnology in the field of disinfection. First of all, we need to appreciate how SARS-CoV-2 is a robust virus. It's very stable virus at room temperature. It can stay up to 3 hours on papers and more like about 2 days on wood and clothes. In addition, it could stay up to 4 days on glass, more than 7 days on stainless steel and plastic, and more than 7 days also on the surgical masks. So it's very stable virus that could persist on surfaces for a long time. How nanotechnology can help us in this? First of all, we can use nanotechnology to manufacture self-disinfecting surfaces to prevent the contamination. Or we can formulate the nanoparticles as a sprayer to be sprayed over contaminated surfaces. A real example on this, which is under investigation now by research groups in universities and companies, using the silver nanoparticles. Silver nanoparticles will release ions, silver ions, which is responsible for the antiviral activity. And this will achieve by a physical interaction between the silver nanoparticles and the virus itself. Another good example is copper nanoparticles. There is a research that was done or was conducted recently, and I think it was in May 2020, to compare between surfaces that include copper and those that did not have copper within it. So when they compared between the two surfaces, they found that the virus can stay up to 6 days or more on surfaces that did not contain copper, while other surfaces, the virus only stayed for less than 60 minutes. So this is how effective using copper nanoparticles could be. Another very novel approach that is under investigation, also called photocatalytic nanoparticles. The principle is very simple here. Using titanium oxygen nanoparticles, those nanoparticles have the ability to inactivate the virus itself when they are exposed to UV wavelength. So exposing those nanoparticles to specific wavelength of UV will kill the virus or inactivate the virus itself. The last field we are going to discuss how nanotechnology can contribute in is the production of medical supplies. We all know that we are using N95 masks here to protect ourselves from the virus. And this N95 masks have like filter matrix to prevent the penetration of the virus into our respiratory system. But according to recent research, the virus is an airborne virus. So the droplets produced from coughing and sneezing will stay in the air for a while, like tens of minutes. So the water will evaporate. When the water evaporates, the size of the droplets will get smaller. So that allow the virus to penetrate through the filter matrix. So this is very dangerous and it could reach our respiratory system. How nanotechnology can help us in this? Nanotechnology can help us to improve the ability of the filters to capture the virus itself. In addition, we can use the nanoparticles to inactivate the captured viruses in the filter matrix. Also, we can use it to make reproducible masks that could kill the virus as soon as it's captured by the filter matrix. A good example on this, and those are real pictures from a journal. They are working on this in the meantime. The idea of this research is spraying the titanium nanoparticles on nanofibers. So those are the titanium nanoparticles on nanofibers, and this is a bigger picture for the filter matrix. When the virus is captured by this filter matrix, titanium nanoparticles could inactivate this virus upon its activation by UV radiation or even sunlight. So it's a very effective way to kill the virus in the mask itself. Another example is the silver nanoparticles. We can replace the titanium oxygen nanoparticles with silver nanoparticles to inactivate the virus itself. So in conclusion, nanotechnology, it's a very promising tool and it's a state-of-art technology that could be used to fight COVID-19 in different and offer solutions in different fields, in diagnostic, treatment and vaccination, disinfectant, and in the production of medical supplies. And we have to appreciate that nanotechnology is needed now more than any time ever to fight the current global public health threat and to prepare ourselves for future pandemics, because this is not the only pandemics we are going to face. According to scientists, we are facing more challenges in the future like COVID-19. Those are the references that I have used, and I recommend if anybody is interested in how COVID-19 could be related to nanotechnology. ACS Nano Journal is very well-known journal that are publishing a lot of articles about this. Thank you so much for listening. This is my email if anybody wants to contact me to discuss this.